Today I will introduce visualization and analysis of the global epidemic. The background and information. Since its outbreak in Wuhan, China in late 2019, the COVID-19 has rapidly spread across the globe and become a global public health crisis. The epidemic has not only posed a serious threat to human life and health, but has also had a profound impact on the global economic, social life, and international cooperation. Epidemic distribution analysis. The global distribution of the epidemic is shown through the use of bubble charts. We selected the top 10 countries in the world in terms of total number of infections as the key observation targets, and used bubble charts to show the outbreaks in these countries, as well as to compare and analyze the outbreaks in other countries around the globe. From the figure, we can see that as of 29 April 2022, the United States of America has the highest number of total infections, followed by India and Brazil, with Western Europe countries generally having a higher number of total infections. Analysis of the dynamics of the number of COVID-19 infections in countries around the globe. In the evolution of the global epidemic, China was the initial site of the COVID-19 epidemic and was the first to be affected by it. However, over time, the outbreak began to spread rapidly across the globe. European countries and the United States became the other hardest hit areas in the spread of the COVID-19. By 26 March 2020, the United States had surpassed China as the country with the highest number of infections in the world. In addition, the number of infections in countries such as India and Brazil is increasing rapidly as the epidemic continues to grow. By 29 April 2022, the United States will still have the highest number of infections globally, followed by India and Brazil. This reflects how the global outbreak is changing between countries and regions, and how it is spreading and impacting at different stages around the world. Line graphic of the dynamics of the total number of people infected with COVID-19. The development of the epidemic in the top 10 countries in terms of total number of infections is observed according to the trend of the line graphic. First, observing from the beginning of 2020, the epidemic started to manifest itself in these countries, but the overall growth was slower. By July 2020, the epidemic began to grow rapidly, due to outbreaks within some countries and accelerated the spread of the epidemic globally. Subsequently, by February 2021, the growth of the outbreak slowed down due to factors such as national country measures and vaccination. However, by the end of 2021, the outbreak was again growing rapidly, possible due to the re-intensification of the spread of the outbreak due to the emergency of new mutated strains of the virus, as well as factors such as the holiday season. By 2022, the trend in outbreak growth begins to level off. Analysis of the number of infections in the United States. According to the fun chart, as of 29 April 2022, there are still many positive patients in the U.S. The vast majority of patients infected with the virus have recovered, as long as a very small number of fatal cases. Although the epidemic spreads quickly, its lethality is very low, and the government can analyze the population characteristics of the fatal cases and prioritize the allocation of healthcare resources to the elderly or patients with underlying disease. Conclusion. The present analysis of the global outbreak shows that the COVID-19 epidemic is spreading rapidly around the world, with serious implications for the socio-economic development of countries. The outbreak has gradually been brought under control as global vaccination rates have increased and preventive and countermeasures continue to be implemented. In the future, we still need to strengthen international cooperation to jointly address the challenges of the epidemic and to promote the control of the global epidemic and economic and social recovery. Thanks for watching.